a holistic approach or a more complete approach towards your clients, their families and others in terms of dental health services is population health. It's also prevention, and you're often you are the ambulance at the bottom of the cliff, mixing our metaphors here, the river and so on. And how do you actually reduce the burden of dental decay in the community and dental caries? And in parallel with that is the obesity epidemic. And sugar is a problem, no question about it at all. And can we actually institute passive things such as taxes, which will change behaviour with the cost signal? And that's what Matt Hopcraft is going to talk about. Matt is a dental health an expert in dental public health, and is also CEO of the Australian Dental Association in Victoria, but please don't hold that against him. Please welcome Matt. Thanks very much.
Thanks, Norman. Am I on? I hope so. So I've been asked to talk about sugar tax, which is something that I've been I guess really kind of passionate and advocating about for a long time, because we know in oral health the important role that sugar plays in dental caries, and we see this happening time and time again. And Norman just mentioned obesity, and I'll touch on that a little bit as well, because we hear the obesity story so much, but we don't necessarily hear the oral health story as much as we should. So I think advocacy and engagement across all levels is really important for us in order to be able to do more to help at that population level. So advocacy really is about trying to get someone else to do something that we want them to do, and it's not easy. We want people to change a policy, to change the way that we do things, and advocacy is about competing choices. So making a compelling argument that what we want them to do is better than what they're currently doing. So we're usually trying to change the status quo, and it's not always easy to convince someone to change what they do. Political change, particularly in this sort of context of a tax on sugar-sweetened beverages, we're trying to get politicians to do something which is impossible. Very difficult. A lot of competing interests, and in the sugar space, we're talking about a lot of really competing interests, industry and so on. And, politicians obviously have got to compete with all of those different people coming through their door and contend with probably the most important thing, which is getting re-elected and winning government or remaining in government. So getting people to change their mind can be really difficult. There's lots of different ways of doing it. Those of you with kids will know that this can be a very effective way of changing someone's mind, changing someone's opinion. I'd love to go into Parliament House one day and just chuck a tantrum and say, why don't you do it? But the role of chucking tantrums in Parliament House is already taken by most of the politicians, I think. But in order to change people's minds, we need to think about how we make choices in the first place. What sort of things influence us? And that's the role of an advocate, to try and influence choice, to influence change. And we make choices all the time, every day, and we think probably that we exercise some free will. But all of the choices that we make are probably influenced a little bit by other people as well. And there's advocacy that goes on all around us, perhaps without really being aware of it. It was really pleasing in the first two talks this morning that there was engagement directly with the audience. So I'll do the same, and I'll engage directly with the audience as well. Who had breakfast this morning? Hands up. It's like pretty much everyone. Who had cereal for breakfast this morning? A few people. So what did you have for your cereal? Did anyone have Cocoa Pops? I'm talking to a room full of dental people. I'm assuming that no one had Cocoa Pops, because you all know that it's loaded with sugar. 3 teaspoons of sugar, 2 health stars on the health star rating system. And that's 3 teaspoons of sugar in the Kellogg's recommended serving size, which is an extraordinarily small bowl, not the really large bowl that the little monkey on the front's eating. And if anyone has kids and has seen them eat Cocoa Pops, they know that they're not eating the little bowl, they're eating the big bowl. What about Nutrigrain? Did anyone have Nutrigrain for breakfast this morning? Ironman food, corn, oats, wheat, 4 health stars. It's really healthy, right? It might surprise you to know, might not surprise you to know, same amount of sugar in a serving size. And again, those of you who've got kids will know that they'll eat half a box of this stuff in a single setting. Nutrigrain's 1/4 sugar. So if you're having Nutrigrain for breakfast, then maybe that's not super healthy. Of course, we're all, really healthy here in the dental setting. So we're having muesli or granola and stuff that looks like it's healthy, and we're having yogurt. Some of those things aren't exactly sugar-free either. So it's possible that you're eating food and you're having breakfast with a reasonable amount of sugar in it without you necessarily knowing that that's the case. Hopefully no one grabbed an up and go this morning because they were running out of time. They needed to get here quickly, because despite the 4.5-star rating, 20 grams of sugar. Now, a lot of that's in the milk, that's in the up and go, but these sorts of products that are marketed to us, that are advocated to us as being healthy, are not necessarily so. So if you had breakfast this morning and you had one of these things, you may well have had more sugar in your diet than you really realised. And you thought you were making a choice, but maybe someone else was making that choice. So you think, were you influenced by health star ratings? That's an advocacy tool. That's an engagement tool that is helping us to choose healthier foods. But maybe that's not always doing that. And, who's sitting there advocating at the health star rating table? It might surprise you to know that a lot of industry sits around the table when the health star rating systems get devised, and when the algorithm that determines how many stars a particular food gets, they're the ones who are in there making sure that their interests are well served. So is your interest as a consumer, or is our interest as oral health professionals trying to reduce the amount of sugar that people eat, really being taken into consideration? This is the challenge that we've got in advocacy, and the important role then that we have in engaging with people to make sure that the oral health needs are being taken into consideration. That slide didn't come out too well, did it? So this is like, what is advocacy? 10 points from Michael Moore. Now, I'm not going to go through them all, obviously, in the interest of time and trying to stick to topic. But the two key ones there, I think, are around establishing a sense of urgency, which is, what is the problem? And then the engagement piece is the number 3, the developing and maintaining influential relationships. And as Norman said, obesity is the thing that we hear a lot about. And if you pick up a newspaper, you watch the TV over the last 2 or 3 years, we hear obesity, obesity, obesity. But we rarely hear that oral health is a problem as well. So it's important for us to think about, how do we create that sense of urgency and make sure that people are talking about the important role of sugar and oral health, as much as they're talking about it in obesity, as much as they're talking about it with diabetes. And we know what the problem is in obesity. 38%, I think 35% of adults are overweight, 28% are obese. Around about a quarter of our children are overweight or obese, and that's increasing. But we see this every day in oral health, and the problem is as bad, perhaps if not worse, in terms of caries prevalence. So 1 in 3 kids by the age of 5 to 6 have experienced tooth decay in their deciduous dentition, and 2 in 5 by the age of 12 to 14 in their permanent dentition. Probably 90% of adults have experienced tooth decay. So this isn't news to us in this room. Our role is to get this message outside of this room to other people to hear what the problem is, because we see this all of the time. But the broader community doesn't necessarily see this, and our politicians, the ones who are talking about and setting these policies, aren't always aware of this either. So, we know 16,000 kids hospitalised every year. The Minister mentioned it this morning in her address. Kids hospitalised, large numbers of children with significant numbers of teeth extracted, and it's happening day in, day out all across Australia. So this is the area that we really need to be tackling. And we know that the link between sugar and dental caries is stronger than probably the link between sugar and obesity, sugar and diabetes, sugar and some of these other health problems. So there's a multitude of health issues there, but we know the issue is really strong in dentistry. We know that the average sugar consumption in Australia is about 60 grams per person per day of added sugar. So it's not the sugar that's already contained in fruits and other things, that's added sugar in the diet. It's about 15 teaspoons. But like anything, the average hides the true story. And so if you just look at the teenagers there, the 14 to 18-year-olds, where the average is about 80 grams, about 20 teaspoons of added sugar a day. But there's about 15% of those teenagers who are having more than 30 teaspoons of sugar a day, and about 5% at the very top who are having more than 44 teaspoons of added sugar a day. So there is a huge problem with the amount of added sugar that people are consuming. And it comes from all sorts of places. But one of the key areas in the blue is sugar-sweetened beverages. And if you look particularly at the kids, 4 to 8 years, it's nearly a quarter of the added sugar coming from sugar-sweetened beverages. The 9 to 13-year-olds, a little over a quarter. And the 14 to 18-year-olds, around about a third of that added sugar is coming from sugar-sweetened beverages. So while it's important for us to look at added sugar wherever it comes in, and talking about cereal at the start, and I'll come back to cereal at the end, because it is a contributor, and junk food, other sorts of foods there. Sugary drinks are a key area of focus because the large amount of sugar is coming from those drinks, and they have no nutritional benefit. It's a can or a bottle with water and sugar, about 10% sugar, a few additives, some acid, which is not good for our teeth either, and nothing else. There's nothing inherently good in those sugar-sweetened beverages. And even the energy drinks that are targeted or marketed in a way to give you some energy and help you get through tough days of study. How do you get through year 12 without Red Bull? I don't know how anyone ever did it back in the good old days. Or how do kids playing sport ever get through a game of junior football without drinking 600 mils of Gatorade? They're marketed to us in a certain way, but they are inherently of no nutritional benefit for us. So I guess the starting point from an advocacy point of view is this document that the World Health Organization put out a couple of years ago now, reviewing all of the evidence around sugar consumption and health, and telling us that really we should look to reduce the amount of sugar that we consume to about 10% of our total energy intake, which is about 12 teaspoons a day, about 50 grams of sugar. So that's less than what the average Australian's consuming. They made a further recommendation, and they said, ideally, we should get that down to less than 5% of our total energy intake, which is about 6 teaspoons of sugar, so about 24 grams of sugar a day. And the little bit of extra evidence that supported the drop from 10% to 5% was specifically around dental caries. So the 10% recommendation took into account caries and obesity and diabetes and cancer and other sorts of health problems. But the little bit of extra evidence to get it down to 5% said, well, there is a real problem with dental caries. It's a life course disease. It continues on. So therefore, there's probably benefit to that. So a lot of people in the advocacy space now use this 6 teaspoons of sugar as, I guess, kind of a starting point for a target that we should be advocating for. Now, a small Coke like that has more than 6 teaspoons of sugar. A can of Coke, 375 ml can of Coke, has 10 teaspoons of sugar. So, we've got an imperative there to really target sugary drinks as being a significant problem, and a tax is kind of a way of doing this. So, gratuitous self-promotion. I guess it's kind of like, how did I get into this advocacy? A lot of people know me. I spent a lot of time at Melbourne University teaching and research in public health and things like water fluoridation and aged care. I spent time working at the DHSV, again in that sort of population health space. And then I had a little bit of a brain fade and went on reality TV show. And I'm probably the only dentist in the world that's ever cooked for Heston Blumenthal and Marco Pierre White. And the point of that is not to brag or anything, but it kind of is. But it was more that when I came off MasterChef a couple of years ago, I became probably one of the most recognised dentists in Australia, which is not a particularly great claim to fame. But it was put me in a really unusual position. And I was having coffee with a good friend of mine, Sophie Beaumont, and I don't know if Sophie's in the room. But Sophie said, and Sophie spends a lot of time at the hospital pulling teeth out of kids under general anaesthetic. And she said, Matt, we've got to do something. This is just terrible. You're the most high-profile dentist going around. Let's be more active. Let's get out there and advocate. Jamie Oliver in the UK was banging on about a sugar tax. She said, you're the Australian Jamie Oliver. I'm like, no, not really. But we started this group called Sugar-Free Smiles. And it was just Sophie and I kind of banging on in the wilderness, trying to do some more advocacy, trying to inject oral health into the conversation. And it was really good because You know, as a little rogue organisation, we weren't constrained by anything. We could do whatever we wanted, whenever we wanted. We didn't have to get press releases sort of checked by committees and all sorts of things. The downside was that we had no money to do it. So it was just Sophie and I and a couple of coffees once a week, and you know, the spare hours between sort of midnight and 6 a.m. writing website content and videos and tweeting and doing crazy things like that. But I think along the way, what we've been able to do is help to raise the profile of the oral health component and talk about the importance of a sugar tax as it relates to dental health. And to focus on the sugar tax bit, I guess, why is the sugar tax a really key area? This is a leaked document from Coca-Cola in Europe, and it's a risk analysis for their business. Down the bottom, the likelihood of any risk to materialise, and the further along you go, the more likely they think that is going to happen. And then the impact on their business up the side, and the higher up you go, the more impact it's going to have. And if you look in the top right-hand corner there, a little bit hard maybe to read, but that little dot, I don't have a pointer, but the little dot right up the top there is taxes on sugar-sweetened beverages. So the thing that they think is most likely to happen and to have the biggest impact on their business. And they've put a big circle around that, and they've said fight back. So for the other areas, they think, you know, we'll monitor this and maybe we'll prepare for action. But this is an area where clearly industry is very concerned, and they're in the fight back stage. Why are they concerned? Well, sugar taxes have been around for over a decade, you know, going back to 2002. But what's happened in very recent times is that there's been an acceleration in countries and jurisdictions that are implementing a sugar tax. And you can see, particularly in the last 12 to 18 months or so, more and more places. And the most recent, United Kingdom and Ireland, in April, 6th of April, was when the UK's sugar tax kicked in. Although they announced it back in 2016, it's taken a little bit of time to get there. But industry is really clearly worried because they can see the momentum building in country after country after country. And they are fighting back. You know, there's no doubt that industry is looking very closely at what advocates are doing all around the world, and they're spending large amounts of money trying to fight sugar taxes. In the US particularly, there's been a lot of movement in some areas that you saw have implemented sugar taxes, and industry are pouring in tens of millions of dollars to fight that. And not surprisingly, they're doing the same here. And so this is part of the advocacy role that we have to try and counter some of this. This is leaked annual report from the Australian Beverages Council, who are the representative body for all of the beverage manufacturers here in Australia. And you can see they're spending significant money trying to keep a sugar tax off the table. They meet regularly with politicians, and they are effectively bragging in the annual report about how their advocacy has helped to keep a sugar tax off the table. Does it work? I mean, of course it does, because when you look at what the politicians are saying, they are saying, we don't think that a sugar tax is right. And that's, whether we're looking at the Nationals and George Christensen, obviously smack in the middle of sugarcane country up in Queensland, but the Health Minister and the opposition are all saying the same things, that a sugar tax is not on the table for us at the moment. So this is not an easy task for us, but our role again is to continue to get out there, to continue to advocate, to continue to engage as widely as we possibly can, and use the resources of everyone to make that argument that a sugar tax is really where we need to be going as one part of a suite of policies. It's not the be-all and end-all. And so engagement looks different to different people, and I think that there's a lot of different ways that we need to approach engagement. We have some really good, organisational level engagement that we see. So the Rethink Sugary Drink Alliance has been going for a number of years now, and DHSV and the Dental Association are strong partners in that, as are the Hygienists Association and the Oral Health Therapists Association. And they do some really good work around advocating, to reduce the amount of sugary drinks that we consume, as well as talking about a sugary tax. You'll be really excited when you see the next ad that they have coming out. They've had some great ones that focus on heart disease and obesity. The next one is going to focus very much on oral health. So that's going to be really good. And we've seen other groups, the Medical Association came out at the start of the year, the College of GPs, that are, again, really big and strong advocates for a tax on sugary drinks. So I think there's a clear role for us at association levels and at organisational levels to engage with these sorts of groups and make sure that when the AMA comes out or the College of GPs comes out and says, we need a tax on sugary drinks because it will help to fight obesity, that there's someone there in the room also saying, and dental caries as well, because we know how important the dental caries problem is. As Lynn said, there's no one right way to engage. I think there's a lot of different ways. So I've spent time writing opinion pieces for paper. I've been on talkback radio and TV and all sorts of things. And each one of those is a really good way of getting a message out. And some of that I've done sort of as an individual. Some of it I've done representing an organisation. But I think we all have an opportunity as individuals to do engagement in our own areas of influence. And that might be small and it might be quite large. And one of the areas that I do, or I try to do advocacy and engagement, is taking a leaf out of the Donald Trump playbook and jump onto Twitter. Now, I'm not convinced of the value of Twitter as a communication and public advocacy tool, but I have had some interesting experiences. So I was at the Children's Hospital earlier this year, and if you've been to the Children's Hospital, you walk in the front door and there's a convenience store there, and that's the fridge on the left-hand side there, full of sugary drinks. And if you walk around the corner to the cafe, there's a fridge there again full of sugary drinks. So we're talking about our leading children's hospital here in, I'm going to say in Australia, because we're from Melbourne here, but certainly our leading children's hospital. And you walk through the door and you're confronted with sugary drinks. It's appalling. And let's not even talk about McDonald's. But it shouldn't be happening. And what we're seeing around the world and in parts of Australia is the removal of sugary drinks from hospitals. But it's not happening here in Victoria at the moment. So I shot out a tweet that was liked by one person and retweeted by no one. But I had a phone call from a senior doctor at the Children's Hospital and arranged a meeting, and we had a bit of a chat about some of the strategies that they are now starting to look at around the sugary drinks that they have in the hospital. So one tweet was able to prompt a little bit of action. And I'll go back a bit, but in the UK, with the sugar tax being proposed there a couple of years ago, a lot of companies, a lot of sugar drink companies have started to reformulate their drinks to remove some of the sugar. And for some strange reason, some of the breakfast cereal manufacturers have jumped on the bandwagon as well. Now, I think they're getting a sense over there that there's going to be a lot more government action on sugar in the UK, and so they're trying to get ahead of the game, and maybe it's about protecting market share. But in the UK, in November last year, Kellogg's announced that we're going to cut sugar in kids' cereals by up to 40%. So I did what any right-minded advocate would do. I tweeted Kellogg's in Australia, and I said, are you going to do the same thing here in Australia? I mean, you're a multinational company. Your company over in the UK is doing this. Surely you're going to do the same thing here. Predictably and probably not surprisingly, they said, no, our customers love our sugary products over here. We've got them so addicted to the high amounts of sugar in our product. They didn't say that, but that's reading between the lines. But clearly, they're kind of working on that principle that they're not going to change, because that's not where they want people to go. There's a lot of analogies between what's been happening in sugar and what's been happening in tobacco, and you can see it's taken a long time with a lot of different advocacy touch points to get smoking rates down. And tax is a key component, but engagement with a wide range of people is really critical. So I think our role as oral health people is to be advocates and to engage in our communities wherever that might be. So whether it's at kindergartens or schools or sporting clubs, removing the sugary drinks from the canteen at a kids' sport, working closely with the other members of our health team. So when we're in community health and we're sitting there with doctors and dietitians and physiotherapists, how do we build some engagement there so that they understand the importance of oral health in there as well? And us all being active in various capacities. You can't read all of that either, but the food and beverage industry tell us that it's all about personal responsibility. It's all about us doing something, and it's not about them doing something instead. So I think it's our role to make sure that we are doing that very strong advocacy. Thank you.
Thank you very much. Gift from Dental Assoc, Victoria. So personal action, I mean, but the ability to levy a sugar tax is a Commonwealth thing, isn't it? State governments have got a cop-out.
Yeah, so state government does, but I think so. We've got, I think, a role here at the state level because we're working here. We heard the minister this morning talking about the huge problems that she's got in funding public dental care, and so I think our role is to really make her a strong advocate for a sugar tax, so that when they sit around the health minister's table at COAG, that we've got all of the state health ministers saying that we can't afford to keep pouring hundreds of millions of dollars into public dentistry for something that is preventable. Let's look at some other ways of helping to prevent, and also raising some money that helps to then fund some of the treatment as well.
The irony is that the Coca-Colas of this world don't necessarily lose any money; they just shift product. It's the political issue is the sugar farmers, isn't it? The cane farmers.
Well, and the sugar industry one is an interesting argument, and certainly there's that political issue that there's probably 8 to 10 seats in Queensland and in northern New South Wales that might be affected. But the reality is that about 90 to 95% of the sugar is exported, and very little sugar is actually kept here in Australia. So a tax on sugary drinks, if it dramatically changed consumption, probably wouldn't have a huge impact on the industry.
So what did you do when you were making your desserts?
I did what I was told on the show. I avoided.
Do what I say, but not what I do.
I avoided making a lot of desserts if I could, and that's a challenge too, because I do advocate obviously to reduce the amount of sugar that you eat as much as you can, and it's that difficult message of moderation versus moderation meaning different things to different people. So it is hard, but I certainly try and cook with as little sugar as I possibly can.
So I've got to tell you an anecdote. I used to be the medical host of Biggest Loser, which was made by the same company as MasterChef, and they're the same crew caterer. So the crew caterer has to be really good for MasterChef. So we would come off the set, and the crew and the hosts would get this sort of creaking table of gourmet food while they go off for a carrot. So you do feel slightly... Please join me.
It was worse for us because the crew got good food, but
you had to eat your own.
Yeah, no, we didn't have anywhere near as good food.
Please, thanks, Matt, very much.
Thank you.
Now it's time for morning tea, and listen out for Jamie's signal to come back in. Thank you very much.